this is something that we need to be paying attention to all year round. I mean, when you're talking about your heart, that's kind of one of those things that's kind of important to survival.
Not something you want to forget about any month.
Not something you want to take lightly, but February, we really pay attention to it. You're going to see a whole lot of red, not just because of Valentine's Day, but it is Heart Month. And our friends from Spartanburg Regional are here to kind of talk about some of the events that they have going on and to give us some signs, the heart attack signs. All right, Dr. Jason Russo, he's with the medical group of the Carolinas, and then Lori Board, good to see you.
Good to see you.
Here.
Thank you.
Guys,
Let's
talk first, and we think heart disease. All right, what exactly does that mean? What is it?
Well, in the classic sense, most people think about coronary artery disease, which means there's a buildup of plaque and calcium in the arteries. When it's extensive enough, it restricts blood flow to the heart and oxygen delivery, and that can result in a heart attack. And you're right, February is a month where we want to raise awareness. We often associate it with Valentine's and so forth. And so we want to get people to be more aware of this condition because it's the #1 killer.
Is this something that we're doing to ourselves, or are you born with the likelihood of getting heart disease, or is it some of the factors?
Kind of two categories. One is the risk factors that can't be modified. That's genetics, knowing your family history. Certainly if you have an immediate family member that has been diagnosed with heart disease at an early age, before 55, you want to be aware of that, but then all the other risk factors in some sense are modifiable. So stop smoking, control your diabetes and sugars, control blood pressure. Then there's the lifestyle things like diet and exercise and so forth.
And all of that, doing that can help, right?
All
like
of it can help, and absolutely it can help. But it takes a concerted effort and some discipline.
Yeah, because it's not easy, especially if you've been on a lifestyle that may not be amazing, you know?
It's hard to make changes, but we recommend gradual changes. Slowly incorporate those into your life, and then it makes it a lot easier.
I like that, because if someone's like watching now and they're like, I mean, you know, they're on all this medication and it's, you know, obviously it's freezing outside.
Right.
So people are like, I don't want to go out and walk or run, except the people that I passed this morning at 6. Right, they're dedicated.
They're dedicated.
They are dedicated. They're dedicated. But what's something they could do right now that could really make a difference and add years to their lives?
Well, walking is a great way to start, just a small walking program. Of course, you do need clearance from your physician. If you have any health-related issues, you need to check with them first. But the mall is a great place to walk
Yeah.
because it's temperature controlled, it's safe.
Yeah.
So that's an easy thing to do.
Like my
Just
granddad used to
start.
have like the marbles in one pot, you know what I mean? It would change it over
Right.
to say.
Or to count the
Right.
laps. That's a great way
Right.
to keep up with that.
Yes. No, okay. This is something that's super important. So y'all pay attention to this. Symptoms or signs of a
Yes.
heart attack.
Yes.
How do you know? Because I could see some people being like, I don't think this is anything. I'm not going to call a doctor, and it could have been something.
And this is the big thing you need to know about heart disease. Everybody knows kind of the classic symptoms, the chest pain, maybe it radiates to the jaw.
You see
or the
people
arm.
grabbing their chest,
Exactly,
you know?
clutching the fist over the chest. But just over 50% of people actually present with that. And so there are a lot of unusual symptoms that people tend to ignore and hopefully thinking it's going to get better, and it doesn't. So shortness of breath that continues to worsen.
When you're not working out or something, just like
Right.
on a normal.
Shortness of breath, but then with exertion as well. If you are working out and it's unusual for you, that continues to gradually worsen over time. Fatigue that does the same thing. Sometimes patients may have nausea. So these are all symptoms you have to kind of take into context with the whole picture. And certainly I want to stress for diabetic patients, they don't feel chest pain like most people would.
Oh gosh, so it's something
So
to
be
think
aware.
about. Is
Exactly.
there like, can I come to you and like you do like a test to just be like, okay, you're good, your heart's okay, you know what I mean? Like I always want to know, like what, am I in the
great
clear?
question, because it all starts with the primary care physician, the family physician, internal medicine physician. And they will do a full history and physical, and patients who are identified to be at risk, certainly they may do non-invasive studies like an EKG to check the rhythm of the heart, or do a stress test to look at how the heart responds under stress. And that may start the initial workup.
All right, that's good, because once you start going to, you know, an internist or your family doctor, they can monitor everything for you.
Right.
Something good to have on tap. Now you have some great events
We do.
that are coming up.
We have a
Tell
very
me
busy
about
month.
these.
February 6th is Go Red Day.
Okay.
So that's in recognition of women and heart disease. We want everybody to wear red, whether
That's
it's
still
a
the
red
number one
tie.
killer, women and heart
It
disease?
is the #1 killer of men and women. And it's historically been seen as a man's disease, but it is a woman's disease. And women need to be aware of that too and know their symptoms. You have to know you're normal. And then if there's something abnormal, you have to act on it. That's the biggest piece, is getting past that denial. I don't have time for that.
Right.
You have to make time to take care of
It's your
yourself.
life.
Exactly. But
Goodness,
back to the
right.
events. February 6th is Go Red Day. February the 14th is the Heart Ball in
Yes,
Greenville.
yes, such a fun event.
And I think we have a website coming up to show how to sign up for that.
Okay.
So that's on Valentine's Day, of course. And then that's a really busy week. February the 17th is our Red Shoe Luncheon that we have at First Presbyterian Church in Spartanburg. It's a wonderful event. We have exercises, medicine as the topic this year.
Oh,
Dr.
good,
John
okay.
Lucas will speak about that. February the 18th, we have our Women Heart Support Group, which is for women with heart disease or at risk for heart disease. And you can just call us for more information about that. February the 21st is our big mega event at Westgate Mall, where we'll have Day of Dance to get up and move. We'll have CPR Saturday to learn how to save a life.
Oh, that's
And
a
then
good
the
one.
cardiovascular screenings also.
That's good. I can't believe you
Yes.
can remember all those on the top of your head. You're good.
Well, on your website, all of those are listed as well, too. All
They
your
are,
events,
yes,
so
yes,
people can
they
go
are.
there too in case
Yes.
they're not can't remember as well as
Right,
you can.
right,
Right.
right.
SpartanburgRegional.com is where you can also go to yourcarolina.tv. We'll have a link of the segment posted right about 11 o'clock, so you can get all this. Thank
Thank
you guys
you.
so
Thank
much.
you
We
so much.
appreciate it. Great tips and advice. We appreciate it so much.